Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib, briefs on top-performing states in the COVID-19 mass vaccination campaign. Shoppers in major goods markets in Akure, the Ondo State capital, flout COVID-19 non-pharmaceutical safety measures. And the United States government commences distribution of 400 million free non-surgical and 95 masks to residents. Thank you for joining us. There is a high risk of the spread of COVID-19 in confined spaces. And it's the reason the Nigeria Center for Disease Control, NCDC, is advising employers and business owners to take responsibility in protecting themselves, their staff, and customers. The agency is also encouraging employers to promote safe work practices, including temperature checks at entrances, the use of the face mask, and other public health measures required to address the pandemic. In the meantime, the country recorded 250 fresh infections and 7 deaths in the last 24 hours. Here's more on the pandemic update.
250 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 12 states and the FCT. That's an increase from the figures reported earlier. Lagos accounted for the highest number of cases with 122 infections. Gombe had 44, FCT 20, Kaduna 19, while Borno registered 16 cases. Delta, Ondo, Rivers, Jigawa, Oyo, Bauchi, Kano and Ogun states logged single-digit infections. The total confirmed cases in Nigeria now stands at 252,678. The report also includes a backlog of confirmed cases from Lagos State and a backlog of deaths from Ondo State, as well as 0 cases from Ekiti, Nasarawa, Osun, Plateau, Sokoto and Zamfara states. 487 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 227,491. There were 7 additional deaths recorded in the last 24 hours, raising the fatality toll to 3,133. Currently, there are over 22,000 active cases in Nigeria, while more than 4 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Oyo State. The total global confirmed cases have surpassed 358 million, while deaths are beyond 5.6 million.
Meanwhile, the National Primary Healthcare Development Agency Executive Director has been given an update on the mass vaccination campaign in the country. And during that update, he says that Nasarawa, Jigawa and the Federal Capital Territory, Ogun State and Kwara State are the top 5 performing states. He's also appealing to state governors to take the vaccination campaign to the grassroots.
Our record as of today, Tuesday, January 25th, 2022, shows that 14,093,873 eligible persons have received their first dose of the COVID-19 vaccine in Nigeria, while 5,252,406 eligible Nigerians have also received their second doses. However, as one would expect, these results are not evenly distributed across the states of the Federation. Our deep dive into the states' performances revealed that Nasarawa, Jigawa, the Federal Capital Territory, Ogun and Kwara states have remained the top 5 performing states on COVID-19 vaccine uptake. It is noteworthy to mention that Jigawa and Lagos states have each vaccinated about 1.5 million eligible Nigerians with the first dose, while the FCT, Nasarawa, Lagos and Delta are leading on second dose administration with more than 10% of their eligible populations already vaccinated.
Although the scourge of the deadly COVID-19 virus is still spreading across the world, there seems to be negligence on the part of many Nigerians, as a large number are not abiding to the safety protocols as directed by government and health officials. In Akure, the Ondo State capital, Channels Television was in Shasha Market, one of the largest markets in the state, to monitor its level of compliance to the coronavirus safety protocols.
This is Shasha Market in Akure, the Ondo State capital, located along the Akure-Owo Expressway. It's a large one where trade is mainly in foodstuff. Fresh commodities such as pepper, yams, onions, vegetables, fruit, and many more arrive here from various parts of the country on a daily basis. In spite of how busy and crowded the market is, only a few people are putting on masks to prevent being infected with the COVID-19 virus. From a chat with some of the buyers and sellers at the markets, some of them still do not believe there is COVID-19 in Nigeria.
What they are calling it is ordinary typhoid fever. So I use this face mask simply because of dogs. I don't believe in it. If you say anybody that use face masks in this area, they use it because of dogs, because of the weather condition. So I've not seen anybody that's closely related to me that have COVID-19. So I don't know. I can't say there is COVID-19, I can't say there's no COVID-19, because in this market now, I'm a trader. In this place, I have my shop in this place. I have not seen anybody.
However, others who've had a close experience with the virus are calling for more awareness.
It's those people that feel the impact, that knows. People are saying it, but this thing is real. At least I've lost 2 people very close to me through this bad pandemic.
Well, I think government should keep on doing it the way you are doing it now. Maybe by laying embassy on it, either on radio, televisions, just to let them know that what they are saying is nothing but the truth, and that every one of them should try as much as possible to protect themselves against it.
The General Secretary of the Shasha Market community says the leadership is encouraging traders at the market to stick to the safety protocol.
We are buying sanitizing items, forcing everybody who is coming inside Shasha. You wash your hand before you come in. If you refuse, we send you back.
Experts say the observation of non-pharmaceutical safety measures is key to eradicating the COVID-19 pandemic. But it seems residents are having a hard time making the connection because cases are dropping in spite of non-observance.
And in Lagos, the government has announced a reduction in the cost of the COVID-19 PCR test at its accredited private laboratories from 50,400 naira to 45,250 naira per PCR test. The government said the reduction will take effect January the 28, 2022. It also said while the 4th wave of COVID-19 has subsided, it will continue to ensure heightened public surveillance for COVID-19 and ensure access to free PCR testing at all its public health facilities. In a statement signed by the Director of Public Affairs, the State Commissioner for Health, Professor Akebayomi, says that the COVID-19 PCR test cost was reviewed by the Lagos State COVID-19 Incident Command Structure and approved by the Lagos State Governor. According to him, the reduction in cost is to cut the expenses to be incurred by citizens who need the PCR test for travel, work, or other purposes other than COVID symptoms or contact tracing. The Commissioner is calling on citizens, particularly inbound passengers who are required by law to test on arrival, to reciprocate the gesture by booking, paying, presenting themselves at any of the accredited laboratory consortium and approved days for their PCR test on arrival in Lagos. He, however, warns that returning passengers desist from dubious actions, such as presenting fake PCR tests, fake COVID vaccination cards, from filling in false travel information at an attempt to bypass the national COVID guidelines. And to talk more about the vaccination, especially in Lagos, joining us is a nurse, Shola Aketi. She is the Deputy Director Nursing, Lagos Ministry of Health. We'd like to thank you for joining us on the program.
Thank you very much. Good evening.
Good evening. Just before we go into talking vaccination, I'd like to know, how would you describe your experience as a nurse since the pandemic started?
Good evening once again, and good evening to our viewers. My experience so far during the COVID-19 era to now has been awesome and challenging. But as a scientist, it was quite interesting because it enables us to drive into a new outlook. Currently,
Oh dear, we appear to have lost audio with Nurse Shola Kete. Hopefully we'll try to... Okay, I believe she's back now.
yeah, in Lagos State, effort is being made to ensure that citizens are able to keep to the expectations. But this event did not just happen, if not because of the proactiveness of the Commissioner of Health. I mean, number one, incident commander, the governor of the state, fully supported by the Commissioner of Health and the other stakeholders. Today, to tell you that we are just ending the fourth wave, January 28th, and pronounced by the Commissioner of Health from 29% to 15%. And currently, we could see that effect came as a result of continuous vaccination. There's a lot of sensitization towards this vaccination being carried out by nurses and other healthcare workers. And not even only that, the travel protocol is being strictly adhered to, and that enabled everybody to be free from getting infected. Herd immunity has increased because the government did not take it lightly with anybody who has not been vaccinated. I could tell you, because of this, nurses are really overwhelming with workload, stress and burnout, because there is increase in demand. Don't forget that this era also creates opportunity for the medical officers, nurses, and the likes to travel abroad. So attrition rate is also on the increase. Because this pandemic is global. But despite that, we still find our people traveling out in order to secure a better, go to cleaner pasture. But by and large, the remaining few healthcare workers in the country are trying to do the possible best to ensure that they nip it at the bud.
Let's talk about,
has increased.
yes. I was just going to talk about that, and that's vaccination. I mean, this is ongoing. We heard from the National Primary Healthcare Executive Director say that from 100,000 people per day, they moved up to 200,000 per day. Tell us a bit about Lagos. It seems to be lagging behind. Some might say it's the population, but tell us what's going on. Do you think a lot of people believe that there's COVID and hence are coming to get vaccinated, or they are discouraged?
They are really coming to get vaccinated. Initially, there are a lot of tales that are not scientifically proven. But with our continuous sensitization and with the leadership trying to ensure that they are available for their people, I could see from all the leaders, religious leaders, traditional leaders, sensitizing their people, we could see the increase in the vaccination. And we are not resting on our oars, but we are trying as much as we could to get everybody vaccinated through this expanded advocacy. However, nurses are always available at all levels, especially at the primary healthcare level, to ensure that this vaccination exercise is being carried out without any issues. Currently, we have most of our centers. They have increased the vaccination centers that also enabled anybody to walk down and get vaccinated. The experience they are having, and which is positive, enabled all these clients to see that they are keeping to the norms. The norms that guide and the guide that guides the vaccination enable them to come out, and after taking the vaccination, they don't experience what they've been hearing. No, a lot of tales, like I said earlier, are really flying about. Which
more
is
like conspiracy theories. We appreciate your time. Thank you so much, Nurse Shola Kete. Hopefully you can join us again. Thank you for the work that you do. Thanks once again.
Thank you so very much.
We're going to break now. When we return, we'll take you to Ghana and more about the situation there. Stay with us. Welcome back. In Ghana, over 10 million COVID-19 vaccine doses have been administered across the country, according to the Johns Hopkins Coronavirus Resource Center. Ghana's health service says more than 6.2 million AstraZeneca vaccines, over 17,000 doses of the Sputnik 5, more than 1 million doses of the Moderna vaccines, Pfizer-BioNTech vaccines have been administered as at last week. So far, over 155,000 confirmed cases have been recorded, while the country's fatality toll stands at 1,370. Now, at the 73rd annual New Year School, which opened at the University of Ghana, President Nana Akufo-Addo attributed the economic foundation laid by his administration to have significantly reduced the impact of COVID-19 on the country's economy. He made reference to interventions such as the GHC 1.1 billion healthcare response package used to procure healthcare supplies and equipment, also a relief package for health workers, and the recruitment of more health professionals, among others. Last month, Ghana issued a revised travel guideline for international passengers that puts the responsibility of vaccination and adherence on both passengers and the airline, such that airlines will not allow passengers who are not properly vaccinated or have no proof of an accepted COVID-19 test to board. And away from Africa, Prime Minister Boris Johnson is fighting to remain in office despite clear indications that he violated lockdown restrictions by hosting or attending parties at his number 10 Downing Street residence. Now, this is ongoing for senior civil servant Sue Gray's report into parties held at Downing Street and other government departments. As expected today, the Prime Minister faced a barrage of questions before MPs, most of them focused on him resigning. Labour's Rushanara Ali said the government had been lurching from scandal to scandal and asked the Prime Minister why he won't write his resignation letter to the Queen. Others, such as South East Cornwall MP, asked Mr Johnson if he would continue to deliver on the priorities of her constituents. While Labour's Lloyd Russell Moyle gave us a song, he says, "Happy on birthday to him," happy on birthday to him, he sang before MPs. The MP said his constituents think Prime Minister lied and asked if Mr Johnson would also resign. The Prime Minister said clearly he has no intention of resigning.
Thank you, Mr Speaker, and can I join with the Prime Minister in his comments in relation to Bloody Sunday? The Ministerial Code says that ministers who knowingly mislead Parliament will be expected to offer their resignation. Does the Prime Minister believe that applies to him?
Prime Minister.
Mr Speaker, of course, but let me tell the House that I think he's inviting a question about an investigation which, as you know, Mr Speaker, I can't comment, and on which he, as a lawyer, Mr Speaker, will know that I can't comment on.
I think the Prime Minister said yes, he agrees the code does apply to him, and therefore, if he misled Parliament, he must resign. On the 8th of December, looks quizzical, he said it. So since he acknowledges the Ministerial Code applies to him, will he now resign?
But meanwhile, Prime Minister and MPs are not the only ones awaiting Sue Gray's report today. Londoners as well. The reports by the Cabinet Office official may determine Mr Johnson's future, but it is not clear when the results of the investigation into the parties held during the lockdown would be published, especially as police have opened their own investigation.
And was definitely against the spirit of what we were all trying to do as a nation. Yeah, and if he's broken the law, then bye, you know, off he should go, because no one should be above the law, even the Prime Minister. And again, it was his birthday on the 19th of June. My baby was 8 days old. My mother couldn't travel over to come and see her. She didn't meet her grandchild until the child was, 6 months old because of restrictions and, all that kind of stuff. And we couldn't have friends round, and nobody could see her, nobody met her, there was so insular. So no, he shouldn't have. He should have been able to read the mood.
Not upset, just angry. I think, he's had other scandals. His party have had other scandals too. It's not just him. So at this point, I'm just a bit apathetic about the whole thing because I just don't think anything's likely to change, but I was very angry.
If the investigation proved that he was breaking the rule, then yes, definitely he was breaking the rule, because a lot of people are dying that time. People are following it strictly. Even today, everybody is on the mask, trying to protect themselves to the families. So as a Prime Minister, it was his responsibility to say, no, we shouldn't be doing that. If he's making a rule, you should lead by example.
Quite mixed feelings there. Well, let's take you now to the United States, where the CDC has said that it is time for everyone ages 12 years and older to get their booster shot. The message is out there to encourage more vaccination uptake in the U.S. The government has also begun distributing 400 million free non-surgical N95 masks to the public from its strategic national stockpile at various pharmacies, stores, also community health centers across the country. This is part of President Joe Biden's plans to curb the COVID-19 pandemic. Here's more on the global update.
The masks are called N95 because they filter at least 95% of particulate matter from the air. The distribution of masks come after President Joe Biden and his team face criticism for not doing enough to encourage mask wearing or bolster testing as the Omicron variant rages across the country and hospitalizations hit a new record. The administration has also recently made free rapid home tests available via a website. Austria's government says lockdown for people not fully vaccinated against coronavirus ends on Monday, January the 31st, because the pressure on hospitals has eased. New daily coronavirus infections are rising, driven by the extremely contagious Omicron variant. The health minister, Wolfgang Mockstein, says they hit a new record above 30,000 today, adding that they could peak in the next 2 weeks at around 35,000 to 40,000. However, the occupancy rate of hospital and intensive care beds has been failing. South Korea's daily new coronavirus cases have exceeded 13,000 for the first time today, while the government seeks to revise its COVID-19 response to focus on the highly contagious but less lethal Omicron variant. The record of 13,012 comes just a day after the tally topped 8,000 for the first time amid a rapid spread of Omicron, despite the extension of tough social distancing rules. Omicron is likely to account for more than 90% of new infections over the next few weeks, with the daily number surging to 20,000 or even more. Finally, the long queues of trucks waiting to cross from Bolivia into Chile keeps adding pressure to government on both sides of the divide. Since mid-January, hundreds of trucks have been delayed as they wait for COVID-19 tests performed at the customs checkpoint in order to let them into Chile. Some drivers have spent up to 5 days queuing in the Tambo Comado mountain pass, where temperatures have been as low as 4 degrees Celsius recently.
And hand washing is a basic and effective tool against infections. Continue to take responsibility. You can visit our website. It's channelstv.com for more updates. You can see our breaking stories there. Plus, you also get to have an understanding of the latest on the coronavirus pandemic. You can see the COVID-19 test, Presidential Committee deactivating passports of 200 defaulters. Other stories at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.